So you want to know, does prostate cancer surgery have complications? Well, this video is all about prostate cancer surgery and its possible complications. Welcome to Health Drum. I'm Dr. Bert Vorstman, a urological surgeon and former researcher, and this channel is all about routine medical conditions, self-care, and digital health so you can be informed and in control of your healthcare needs. By the way, if this is your first time on the channel and you like to get fact-based healthcare details and not fiction, go ahead and subscribe below. By the way, Health Drum is for educational and informational purposes only and not a substitute for professional medical advice. And the links to this disclaimer and the material in this video are in the description below. So let's get into it. Does prostate cancer surgery have complications? And let's sort fact from fiction. So radical prostate cancer surgery, both open and robotic, are associated with probably more complications than any other surgical procedure. And robotic prostatectomy has even more because of positioning and trocar issues. So radical prostate cancer surgery, both open and robotic, are associated with numerous complications. The complications can be divided into intraoperative or during surgery, complications within 30 days, complications associated with residual cancer or recurrent cancer, and the many sexual and urinary complications, as well as others. So let's look at the potential for intraoperative complications during radical prostate cancer surgery. So unlike open surgery, robotic surgery is associated with trocar and positioning injuries. A trocar is a tube-like device that can be stabbed through the skin and then be used to access a cavity within the body. Both open and robotic prostatectomy are associated with bleeding and hemorrhaging, and some patients are still required to donate blood before surgery. As well, there is the potential for ureteral, rectal, bowel, and nerve injuries. Injuries to the nerves for erection were the reason behind the nerve-sparing surgery in radical prostate cancer work. So let's talk about potential complications within 30 days after surgery. So the potential complications possible within 30 days of prostate cancer surgery include deep vein thromboses, pulmonary embolism, wound infection, wound dehiscence or wound separation, hernias, anastomotic leaks, secondary bleeds, and lymphoceles, which can happen after removing pelvic lymph nodes. So let's look at the cancer-removing ability for radical prostate cancer surgery, whether open or robotic. So after radical prostatectomy, some 11 to 48% of men will have a positive margin or residual cancer. On the other hand, some 20 to 40% will have a biochemical recurrence due to residual cancer cells within 10 years of surgery. These results show clearly that both open and robotic prostatectomy have high residual cancer and cancer recurrence rates. Clearly, both open and robotic prostatectomy are bad cancer operations because of these high residual and recurrence rates. So let's look at the bladder and urinary complications possible after radical prostate cancer surgery. So there are many potential bladder and urinary complications associated with open and robotic prostatectomy. These include urinary leakage or incontinence, bladder neck scarring, clip migration, and stone formation. Clips are used during surgery to clip vessels and stop bleeding. There's urethral scarring or strictures and other urinary issues such as burning or pressure discomfort and recurrent urinary tract infections. So let's look at the many penile complications possible after radical prostate cancer surgery. So in addition to the potential bladder and urinary complications associated with both open and robotic prostatectomy, there are many potential penile complications. These include loss of libido and manhood, partial or total loss of erections, lack of ejaculation or ejaculating urine, pain on orgasm, if the patient is lucky enough to still have erections, shortened penis, bending of the penis, numbness and wasting of the penis, and other potential complications such as infertility, depression, and suicide. So surgeons are very aware of the many potential complications associated with radical prostate cancer surgery, whether open or robotic. So how do they pass this information on to patients? So physicians are quite aware of the many potential complications associated with both open and robotic prostatectomy, yet they will describe this procedure to their patients with superlatives such as standard of care, gold standard, cut to cure, and minimally invasive, amongst others. And they go to great lengths to explain the procedure through the processes of shared decision making and having patients sign detailed informed consents. And although FDA approved, the robotic device, like the open prostatectomy, never underwent any scientific evaluation for safety and benefits. The device was simply rubber stamped as approved. And the fact that robotic prostatectomy follows medical guidelines and is covered by insurance and approved by support groups is absolutely hollow. So in addition to the shared decision-making and detailed informed consents, physicians will also be describing their pre- and post-op counseling and rehabilitation programs. What is all this about? So the strategy of preoperative and postoperative counseling and rehabilitation programs is to try and mitigate against the many inevitable potential complications associated with the bladder and penis after prostate cancer surgery, a tactic so patients and their spouses can be mentally prepared for bad outcomes and less regret. So despite the shared decision-making, the detailed informed consent, the pre-op and post-op counseling programs, many patients still get complications. Let's check. So despite the discussions with patients about risk tolerances, treatment preferences, and the preoperative and postoperative penile and bladder rehabilitation programs, complications remain disturbingly common. The high incidence of residual cancer or rising PSA often gets treated with radiation to the prostate bed and pelvic lymph node areas. Urinary leakage or incontinence is treated with penile clamps, pelvic floor exercises, medications, pads, biofeedback, bulking injections, slings, catheters, electrical stimulation devices, or artificial sphincters. Erection issues are often treated with medications such as Cialis, suction devices, shockwave or vibration therapy, urethral suppositories, these are not manufactured anymore, penile injections or penile implants, and many patients require repeat or alternative treatments for their limp and leaking complications with prosthetic devices. Even worse, the breakdown of the various implanted devices often results in even more corrective surgery, costs, and time wasting, while the patient and wife or partner struggle to maintain a relationship and retain some quality of life. So clearly, radical prostate cancer surgery, whether open or robotic, is associated with many potential complications. But does it save significant numbers of lives? Remember, only some 11% of all medical treatments are of known benefit, and healthcare is plagued with false hope, false promises, and fiction. So, looking at prostate cancer surgery, not only is there a high incidence of residual and recurrent cancer, radical prostate cancer surgery is impacted by numerous potential complications, out-of-pocket costs, and downtime. However, the big question, does radical prostatectomy save significant numbers of lives? Unfortunately, it doesn't. In fact, no treatment has a similar 15-year survival to patients that had surgery or radiation. So in this video, does prostate cancer surgery have complications? You learned that prostate cancer surgery has many potential complications and that there's no irrefutable and reproducible evidence that prostate cancer surgery saves significant numbers of lives. To learn more about routine medical conditions, self-care, and digital health, check out these other videos.